And good morning. This is the 1578th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SUMANA KUMARI PANDA, MD. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy was formed at the time of COVID when there was no connectivity among doctors and homeopathic lovers. And during the time of COVID, a group of homeopathic lovers started this session, a group, and as a result, we were able to communicate to one another. And we have started 3 sessions every day. The first session of the day is already over. That is our Hindi session from 7:30 to 8:30. And we have the international session in English from 8:30 to 9:30, and another local language session at 9:30 to 10:30. All these sessions are going in a good way, and we are uploading the videos of the sessions on the very next day itself, so that you can watch it at YouTube by searching IFPH homeopathy. Today, Dr. SUMANA KUMARI PANDA, MD, was a retired district medical officer, homeopathy, Cuttack Circle, Cuttack Health and Family Welfare Department, Government of Odisha. She serves in government sector by a beautiful way and has lot of patients. She was able to cure a lot of patients as well as propagating homeopathy in different part of Odisha in a better way. And she is a consultant now at the Malaysia Homeo Clinic, Cuttack, Odisha. Homeopathic clinical experience of 35 years to treat chronic cases of all types, more especially chest and gynecological cases, palliative care of cancer cases at the Malaysia Clinic, Cuttack, Odisha. Teaching experience of 18 years at the captain of material. She has worked in the Department of Material Medica at Dr. Abin Chandra Homeopathic Medical College Hospital, Bhubaneswar. She is interested in research and worked as the principal investigator in collaborative research project under CCRH, Government of India, on efficacy of homeopathic therapy on duration of labor. She is a resource person at various induction training, skill development training, reorientation training programs, etc. She has presented various scientific papers nationally as well as internationally in different parts of the world. She has published a lot of articles in peer-reviewed journals like IJRH, PB Muted, etc. She has won the Best Homeopath Award, Hold Barrier by Marvel Mahila Samaj Woman of Inspiration by Lions Club, Best Woman Social Worker by Odisha Nari Seva Sangha Cuttack Branch, Bharati Homeoratna by Wilson Homeopathy, etc. Served through Lions Club International as diabetic chairperson and in create diabetes awareness throughout Odisha, and recall the program international president of Model Medal. She has won the International Presidential Medal in about clinical application of phosphorus, part 1. This will have 2 sessions. The second part will be on day after tomorrow. Anyway, doctor has presented a lot of presentation in our forum. Let us welcome the Dr. SUMANA KUMARI PANDA to this session. Welcome, madam.
Namaste. Thank you, Dr. Danesh. Really, just now my video is not working. So am I audible to you all?
Yes. We can clearly hear you.
Okay.
Maybe the network problem there.
Might be. Just now the video, just 2 minutes before it was there, but now it is not there. Okay. So at the outset, I am very much thankful to the organizers of IFPH for giving me the chance to speak in this great forum. And I am very much grateful to Dr. Sani, my teacher, and Dr. Dhanesh, my friend, Dr. Manoj. So, and all other participants, really, I am very much grateful to you. Thank you very much. Now, coming to the topic, today my topic is the clinical application of phosphorus.
Okay.
Okay. Thank
Okay.
you,
Now,
Dr. Dhanesh.
now you can share the screen.
Yes, now everything is okay.
Yes, other things with technicalities.
Is it visible now?
No, you have not yet shared. Please try to share once
Okay,
again.
okay.
Open the lab first. Share at the center of the green. Yes, now it is coming. Okay.
Yes. Is it visible now?
Yes. Warm welcome to all participants.
Yes. Thank you.
Everything fine now.
Very fine now. Is it visible?
Yes.
Yes. Okay. So today, coming to the topic proper, today's topic, clinical application of phosphorus. So I have two sessions. Today we will talk about the mathematical part along with some cases. And on 28th evening, I will go through the rest part. So first, phosphorus came from Greek word. Phos means light and phoro means to bring or to bear, that is to bear light. So phosphorus brings light specifically because it is highly inflammable when comes in contact with the air and illuminates light, but burning is there. And with patients also in very difficult cases, like cancerous cases, in case of menorrhagia, metrorrhagia, in neurological cases, really we bring light, we bring smile in the face of the patient. So phosphorus is such a deep acting polycrest drug, and almost all systems are covered up with phosphorus. Coming to the diathesis, we find hemorrhagic and tubercular diathesis. Temperament is a sanguine temperament, and miasm, tubercular miasm. In phosphorus, we find high energy with emaciation and weakness. Coming to constitution, as this is the topic of today is clinical application of phosphorus. Clinically, from the constitution itself, also we can have a thought that this patient might be phosphorus. If the generals will not match, then we may not go to the phosphorus. But even if the constitution gives an indication to us that this case might be phosphorus. So constitution is very important in case of phosphorus. Only the recollection of a memory. We have to recollect memory. Already everyone knows, all the doctors are very well concerned about these symptoms. So I will go fast and just recollection of memory. So phosphorus is very lean, thin, tall, slender, with delicate hair, long curved eyelashes, and a very graceful walk. Not they are not very aggressive. They are very gentle in their behavior. They are very good people. Okay, we can say very impressionable people. They are so benevolent, so impressionable. It is very difficult in part of the physician to ignore them. So they grow too, the young people grow too rapidly, and uh, but they grow too rapidly in longitudinal manner. That's why they become tall. Calcarea carp in young age also grows too rapidly, but in transverse manner. That's why they become very obese, and phosphorus becomes tall. Due to the tallness, the body, according to, if we will see the food quality and the weight, it is definitely less in case of phosphorus. The mind is very sharp, but the physical body is not so strong. That's why he becomes stoop shoulder. So grow too rapidly and they become tall, but the strength is not that much with them. That's why they stoop shouldered persons. In sulfur also we find stoop shouldered, but they are by nature stoop shouldered. Phosphorus, but nature is not like that. Phosphorus, due to weakness and growing too rapidly, becoming tall too rapidly, that's why becomes stoop shouldered. And the anemic persons, especially during puberty, we find anemic girls and emaciated, delicate skin, thysical persons from hereditary tendency to consumption. They have the hereditary tendency in hereditary family history. You will find most of the phosphorus cases, asthma, tuberculosis, like that, pneumonia, so like this. And people who had bone disease in childhood, premature old age, just like argentum nitricum, lycopodium, also we find this similar constitution. And old people with morning diarrhea, this is a very, phosphorus is a very good drug. Really, a cancer liver case, surgery was done for palliative care. Uh, Old man of 75 years and a tall, slender, chronic cough was there, and with morning diarrhea. Really, he has taken many more allopathic drugs. After that, one day he called me to his house because he was so prostrated, he was unable to walk even. So in that case, I went to his house to see him, and basing upon these symptoms, I prescribed phosphorus, and he was cured of diarrhea uh, by phosphorus. So very reliable drug. Coming to the pathogenesis, if we will see, as we are discussing the mathematica of phosphorus, so when we find pathogenesis, it affects, phosphorus affects almost all systems. So first is fatty degeneration. We find fatty degeneration in liver, in heart, in spleen, in kidney. We find in case of phosphorus. In liver, if we will discuss about the liver, then also we find lycopodium, mercurius are two good drugs for fatty degeneration of liver. But when talking about the fatty degeneration of heart, we are having drugs like arnica, arsenicum, aurum, and phosphorus. We have cactus and very good drugs. Naja is also a good drug for fatty degeneration of a heart. So in these cases we find, and in phosphorus also we find fatty degeneration. Severe hemorrhage. Why hemorrhage is there in case of phosphorus? Because phosphorus causes the degeneration of arteries. So degenerative process is more marked in case of phosphorus. Even in eye also we find, due to degeneration of the optic nerve, we find blindness. Phosphorus is a very, very good drug for blindness, amaurosis, temporary blindness, glaucoma. I have seen, we have cured a case in Abhin Chandra OPD, a lady of 60 for 5 years suffering from glaucoma, and with the history of sexual excess in her young age, with the constitution itself phosphorus, we had gone for phosphorus, and she was improved very well from glaucoma, which was she was doing regular checkup in LV Prasad Eye Hospital, and I told her to go to LV Prasad and check there whether your glaucoma condition improved or not, and the glaucoma condition was improving with phosphorus. Very, very good drug for glaucoma also, we can say, phosphorus. Next, and it causes severe hemorrhage from any orifice. Might be nose, might be mouth, might be lungs, might be anal, might be menorrhagia, metrorrhagia, vaginal hemorrhage. So, from any orifice, from any place, even if from skin we find, in case of phosphorus, ecchymosis is a very, very good drug, phosphorus. So, in next coming to bones, we find necrosis. Necrosis, caries, all the things we find specifically of lower jaw. Necrosis of lower jaw and shin bones. I will come across under the marked features guiding symptoms, and we will compare with other drugs then. Next, affecting the cerebrospinal system, the nerves, we find trembling, we find chorea, we find neuralgia of different types, paralysis, left-sided paralysis. As phosphorus is a very good drug for left side, we find paralysis affecting the neural nerves. Even if in eyes also an optic nerve is affected. So inflammation of the mucous membrane. Inflammation of mucous membrane we find in case of mouth, causing mouth ulcers, gingivitis, gum bleeding, and in stomach, it may cause vomiting, nausea, may cause hematemesis. Even if phosphorus is a very good drug for cancer stomach, palliative care in stomach, and lungs, mucous membrane of lungs is affected, causing it. It's a good drug for causing pneumonia, for thyroids, and intestines are also affected, causing chronic diarrhea. Chronic diarrhea for old people, phosphorus is a very, very good drug, Hahnemann has written. So, we can rely on phosphorus for chronic diarrhea of the old people, what Hahnemann has written. So coming to the marked features, what are the keynote symptoms, guiding symptoms we can say? In phosphorus, we find burning. Last trio of burning, we know the arsenic, next is sulfur, next is phosphorus. So arsenic, phosphorus, and sulfur we find. In case of arsenic, we find the burning relieved by hot application, warm application. But here we find in case of phosphorus, we find burning relieved by cold drinks, specifically in stomach. Burning pain in stomach relieved by icy cold drinks. Okay. So that relieves. Of course, after some time when the food becomes warm, the vomiting is aggravated. But immediately the patient, any duodenal ulcer pain, in many cases, I have experienced many cases. The duodenal ulcer pain, which is aggravation in empty stomach, relieved after eating, very peculiar burning pain in stomach, relieved by cold milk or cold, the ice cold water. Immediately the pain relieved, and after some time there will be time we will give medicine, that's all. But immediately you will get, it is relieved by icy cold drinks. So that happens in case of phosphorus. Again, if we will look after the location, then in location wise we find arsenic and sulfur affects almost all organs. but phosphorus has definitely a inclination towards the spine, specifically in between the shoulders. Burning pain in spine, and we find in case of phosphorus. Along with other generalities, the phosphorus can be prescribed, and sulfur, the burning pains anywhere we may find, specifically in skin conditions associated with skin conditions, relieved by cold application, but phosphorus relieved by drinking icy cold water and burning pain in between shoulders. When discussing about the burning pain in spine, we have very good drugs like picric acid and zinc mate. So just like atfar with phosphorus. But in phosphorus, we find burning pain in spine after sexual excess. This is the causative factor. And in picric acid, burning pain in spine, whole spine, but that is mostly after mental exhaustion. After the many mental exhaustion, we find a positive factor is the mental exhaustion. And in zinc, the whole spine is burning and very sensitive to touch. Very sensitive to touch we find in case of zinc associated with fidgety lower limbs. We find there. And in phosphorus, this burning pain in spine associated with restlessness and fidgetiness all over the body. We find in case of phosphorus. Next, coming to bleeding. Bleeding is a major symptom in case of phosphorus as hemorrhagic diathesis, and we find bleeding is of bright red blood. Bright red blood we find in case of phosphorus. That might be epistaxis, that might be hematemesis, and another feature also we find, just like bryonia, the vicarious bleeding. Instead of menses, the epistaxis happens in case of bryonia, but in phosphorus, we may have, instead of menses, we may have epistaxis, we may have hematemesis, we may have hemoptysis or hematuria, anything. So that is the vicarious symptom we find in case of phosphorus, and bleeding is so profuse that might be coming menorrhagia, metrorrhagia. The in case of cancer rectum, I have seen phosphorus nitric acid, hamamelis are very good drugs in cancer rectum. Bleeding is there, and in case of hemoptysis also we find, just like Acalipha indica, we find phosphorus. But it is bright red blood, and profuseness is there in case of bleeding of phosphorus. Menorrhagia, metrorrhagia, menopausal bleeding, climacteric bleeding. In cancer cervix, phosphorus is a very good drug associated with the bleeding. In cancer liver, also malignant jaundice, hemolytic jaundice, we find the phosphorus is a very good drug. So bleeding is very acute we find in case of phosphorus, but bright red blood. Dark blood we find in case of Crotalus horridus, and bright or dark one acid nitric is there. The hemamal is so dark, the bright red millefolium. So many hemorrhagic drugs are there. Ipecac is there, which is having the bright red blood associated with nausea, vomiting. So we can differentiate like this. But remember, the constitution and the generals are too important. Physical generals and mental generals are very important for selection of the remedy. Next is a suddenness. Sudden attacks of symptoms, sudden fainting. We find in neurological conditions, specifically sudden fainting, sudden blindness. I told you, I mean amaurosis after sexual excess. We find after loss of vital fluids. We find the elements from in phosphorus. The all cold air, cold weather, empty stomach, thunderstorm are also the elements from in many conditions. So sudden attacks of symptoms like sudden fainting attacks, sudden blindness, sudden prostration, like paralytic lassitude. We find the not be particularly paralysis, but we find lassitude like paralytic weakness. So great prostration is there. We find in case of fatigueness is there, trembling is there. So this may happen suddenly in case of phosphorus. Next, coming to emptiness, an empty sensation that might be in stomach, that might be in chest, in abdomen, we may find, but empty organ sensation in stomach relieved after aggravation in empty stomach and relieved after eating, just like anacardium, chelidonium, petroleum, graphitis, sorinum, we find this phosphorus is also a drug. And another symptom also we find in emptiness, that is the emptiness in stomach associated, sometimes we find the bonding associated with the pain in stomach. The empty sensation is aggravated by 10 to 11 a.m. Just like 11 a.m., just like sulfur, we find this symptom. Phosphorus is having, of course, sulfur is leading in this aspect. Phosphorus is not that much leading in this aspect. And sulfur is not relieved after eating. And in phosphorus, we find relieved after eating. And this empty sensation in stomach might be in pathological conditions like chronic gastritis, might be in chronic gastric ulcer, duodenal ulcer, or cancer stomach, and in GERD also. Gastroesophageal reflux disorder, we find this is a good drug. So, of course, not like asafoetida. Asafoetida is Elapse, asafoetida are very good drugs for GERD. Phosphorus is not like that, but if it is associated with aggravation in empty stomach and relieved after eating, and another symptom of stomach is very, very important really, we find vomiting. Vomiting just the just after the food becomes warm inside the stomach. So vomiting is very profuse also. The copiousness we find in vomiting, that might be blood vomiting also. So I will discuss a case of um, chronic jaundice, that is hepatitis A case, but malignant hepatitis. Basing upon these symptoms, the aggravation pain in stomach, aggravation empty stomach relieved after eating, vomiting, the 1 hour after food. You can say warm when the food becomes warm, so that might be 45 minutes to 1 year, 1 hour. So after food, vomits everything. So, and associated with the mental generals, I had gone for phosphorus and the case was cured with that. So this is the emptiness sensation we find. Then tightness. So tightness sensation we find in chest region. This is as if a stone is there. Very tight, heaviness in chest region, just like sternum we find in case of phosphorus, as if a stone, a heavy load is on chest region. So we find that symptom might be associated with pneumonia, might be associated with the tubercular conditions, but might be with chronic bronchitis, asthma, like that also. We may get that symptom. And associated with that symptom, if we will discuss, then the respiratory symptom, along with in the respiratory symptoms, we find this is the cough is aggravated in evening, aggravated lying on left side, and the pain in left chest we may find with this, and we may find cough aggravated by the crying, by weeping, by laughing, by talking. And so just like sternum, spongia, we find these symptoms. So here also we find from cold and warmth reliefs. In hoarseness might be there in case of phosphorus, in keynote prescription, in acute conditions like hoarseness, aggravation evening, that is phosphorus carbobase, aggravation morning, calgary carb causticum. So like that, this is the acute prescription we can go for. And the next, craving for cold drinks, as I had told you, craving for juicy things. We find specifically cold, icy cold water, milk, and fish. Desire, but under physical generals, we will come across first craving for cold drinks, icy cold drinks, which relieves also we find in case of phosphorus. Then next is oversensitiveness. Oversensitiveness to external impressions. We have many more drugs like Noxvomica, like CPR, many more drugs are there. So trembling of limbs from slight exertion, paralytic lassitude after a short walk, and very overexertion after stool. So very oversensitive, even if mentally the patient is also very sensitive, we find. Next is restlessness. Already we had discussed that restlessness, fidgety all over the body we find in case of phosphorus, just like zincum, medurinum, mercurius. We find so zincum, the lower part of the lower limbs, fidgetiness of lower limbs. In bryonia, we find fidgetiness of one forearms or one leg like that. So, but in phosphorus, we find fidgetiness all over the body. Tuberculinum also we find this restlessness. And aggravation from lying on left side, this is a very, very good symptom for prescription of phosphorus. Vertigo associated with many complaints. We find a chronic vertigo patients might be phosphorus if the generals match. Blindness already discussed. After sexual excess, phosphorus is a very good drug for eye symptoms. That even if the edema of both eyelids associated with fatty degeneration of a heart, we may find in case of phosphorus. Upper eyelid swelling is calicar, lower eyelid epismele, you know all these things. And epismele usually associated with the nephrotic symptoms, and phosphorus usually associated with cardiac symptoms. So sudden attack might be without any cause of blindness. If we are not finding any cause of blindness, or if it is after typhoid, after lightning, so we can think of phosphorus very well. Next is necrosis. So coming to necrosis, a fistula has a tendency to form fistula in phosphorus we find, just like Berberis vulgaris, borax, calcareous salt, silesia, natramur. So many more drugs are there for fistula. And coming to necrosis specifically, phosphorus is a very, very good drug for necrosis of lower jaw. Necrosis of lower jaw and the shin bone, the tibia, we find. Here we can see that we can compare this with angostura, with silesia, with our manganum aceticum and asafoetida are very, very good drugs. So how to differentiate? We can differentiate angostura vera is also a good drug for necrosis, but that is associated with the cracking sound in joints, the motor paralysis, motor weakness occurs in case of angostura vera. And in case of phosphorus, we find the necrosis is affecting the mandible, but in angostura vera, the bone marrow might be affected. So, which might not be found in case of phosphorus. And generals should be there for prescription. In case of asafoetida, we find that is a syphilitic drug. We find the oversensitiveness, very sensitive to touch. That affects the long bones specifically. And pain is aggravated at night and oversensitive to touch. Here we can think of the syphilitic drug Aromet also is a very, very good drug for necrosis of the bones. But in Aromet we find the nasal bones, palatine bones and the mastoid and the head. We find the scalp bones. There might be exostosis. Just like in Assafoetida also, we find in Angostura vera, in Angostura vera we find exostosis of on skull. And here also we find in case of Oromate also we may find these symptoms. So in Oromate as a syphilitic drug, aggravation at night, just like Assafoetida, but Assafoetida is oversensitive to touch, which we don't find in case of Oromate. Manganum aceticum is also a very, very good drug for necrosis of the bones, but the location wise, if we can think that it is for ankles. Just like natrum carp, pulsatilla, ruta, and manganum aceticum is more syphilitic, So necrosis of the bones we find in case of Angostura is not so syphilitic, it is psychotic. So that's why it is a good drug for cervical spondylitis, a good drug for Angostura, osteoarthritis. But phosphorus is more towards syphilitic. Tubercular affection, the necrosis is there. Okay, so this is about the necrosis we find in case of phosphorus, and violence, rapidity, copiousness. Violence, violence of these symptoms we find in case of phosphorus, specifically in neurological conditions, in rapidity, in blindness we find, and copiousness we find the um, violent pain also, burning pain also we find in case of phosphorus, and copiousness, stool. Specifically, I told you that old people with morning diarrhea, phosphorus, chronic diarrhea, phosphorus, old people. But in young also we find of the great prostration after a single bout of stool. That's why the stool is so copious, a bucket full of stool, and a sensation as if the anus is wide open. So as if the stool is coming from a bunghole. So like this, the copiousness counts here. Okay. The prostration we find in case of arsenic, great prostration, even after 1 to 2 bouts of stool. But this quantity is very less. In phosphorus, the quantity is too much. In just like APs, phosphorus, in veratrum also, for podophyllum also, the copious stool is there. Vomiting is also copiousness we find in case of vomiting in phosphorus. Next, relaxation is also a symptom. Already we have discussed. Evening aggravation, thunderstorm aggravation are also the symptoms in case of phosphorus. So these are the guiding features or keynote features we find in phosphorus. Next, coming to physical generals. So under physical generals, as we know, this is a left-sided drug, phosphorus, but it affects the heart, fatty degeneration. No, it affects the lungs, specifically pneumonia. During pneumonia, we find the right lungs lower lobe is very much affected in case of phosphorus. Though a left-sided drug, but the right lungs lower lobe is affected in case of phosphorus. So phosphorus is chilly patient, susceptible to cold, and tendency to scrofula is also there. The tubercular constitution already I had discussed, and craving for extra salt, cold drinks, icy cold drinks we find in case of phosphorus, and phosphorus also craves for fish, for milk, and for juicy things, all juicy food. Phosphorus craves, and thirst is very much increased. Violent thirst for cold water, icy cold water we find in case of phosphorus. Even in winter, say I had a case of trembling of the hands Basing upon this symptom, I thought this might be phosphorus. Even in the winter, she wants the icy cold water. Icy cold water, even in winter. So basing upon this, I thought this case might be phosphorus. So this symptom is very, very important, valuable. So stool, usually two types of stool we find in case of phosphorus. Might be constipation, might be diarrhea. Diarrhea already discussed that the of old people morning diarrhea and forceful stool. But usually in young we find constipation and the stool is long, slender, dry, like dog stool. Offensive, very offensive. And in diarrhea, we may find the undigested particles like sagu-like particles we may find in case of phosphorus. Next, sleep is disturbed sleep really in phosphorus due to dream. Dream is violent dreams, frightful dreams, the horror dreams she has. That's why very disturbed sleep we find in case of phosphorus. Next, coming to sweat. Sweat is profuse, clammy night sweats. During sleep, we will have sweat, but sweat without relief, just like mercury. In mercury, we know sweat without relief. In natramur, we find sweat relieves the symptoms. In mercury, we find sweat does not relieve. And here also in case of phosphorus, we find sweat does not relieve. Okay. So that's why another symptom we find, the sweat smells like sulfur. Sweat, phosphorus sweat smells like sulfur. We find in case of phosphorus. Just like bovista smells like garlic, here we find sweat smells like sulfur. Coming to male sex, we find increased sexual appetite, nymphomania in both the sex we find in case of phosphorus. Impotency also we find in case of phosphorus. And in female sex, we find frequent, profuse, protracted menses. Bright red menses in many cases, in dysfunctional uterine bleeding, in menorrhagia, in metrorrhagia, in climacteric menorrhagia, menopausal bleeding, phosphorus, everyone might have experience. I have too many cases. So with phosphorus that was cured, very good drug really for hemorrhagic diathesis. This is all about the maybe wound healing is slow we find in case of phosphorus. Next, coming to a case, in next session we will go for mental generals and other cases. These cases are mostly based upon physical generals and the characteristic peculiar symptoms. This is a girl of 14 years, fair looking, lean and thin. I have less time, so I will go fast. Lean and thin, average height, was suffering from menorrhagia for last 6 months. At present, menorrhagia of 28 days when she approached me. She had regular menses, but profuse, that is 5 to 6 pairs per day, protracted, and she has to take hormone replacement therapy with allopathic doctors to stop bleeding every month. So after 5 6 months, the parents became very hectic and they came to me, and I had other symptoms like cough and cold, aggravation in winter, aggravation from cold. Uh, she was ambithermic and very susceptible to cold. Desire for salt, the single plus, ice cream triple plus, and cold drinks double plus. So the base, this is very very important in her, in that case. And she was the girl was very mild, gentle, approachable, well behaved. In past history, she had recurrent cold attacks. So millepolium tincture 10 drops thrice daily given to stop bleeding fast. Then, but the flow not reduced but not ceased completely. So after that, after 1 week, I went for phosphorus millesimal scale, phosphorus 01, 02, 03, like that. At the beginning, I went for phosphorus 01 once daily, 02 once daily, next 03 alternate morning, like that. I continued for 3 months and the case was cured with that and no more recurrence was there. In this case, the differential diagnosis might be carbovase, calcarea phos, cactus, hamamelis, erizeron, arsenic, and silesia. So we can think of erizeron is also a very, very good drug, bright red blood, along with bright red blood, profuseness is there in case of erizeron, we find. But here we find the general desire salt, ice cream, cold drinks, like that, and I went for this. Even if in calcarea phos also you will find desire salt is there to some extent, but ice cream triple plus, cold drinks double plus, and very approachable, well behaved. Calcarea phos is very depressed. The child is very depressed. So in that case, carbovase is dark blood, hamamal is dark blood, cactus bright red, aggravation in daytime. So it was not there. So like this, the prescription was phosphorus. This is a case of chronic gingivitis, soreness, swollen gums, aggravation, cold food, cold drinks, relieved by warm drinks, bleeding gums, frank blood, and aggravation after brushing. These are the drugs can be thought of: mercury, nitric acid, bovista, creosote, carbovase, like this. And she was also chilly, desire salt and cold drinks, fear of thunderstorms. So basing upon this, phosphorus in diluted doses I had gone, because at that time in my clinics millesimal scale was not available. That's why I went for phosphorus 30 in diluted doses, 1 teaspoonful twice daily, followed by patient phosphorus 200, and after 3 months she was cured. A chronic gingivitis, very long case.
Okay,
So this is
madam, let us conclude the session for the time being, and we can go with some discussion, and then we can present the second part on the day after tomorrow. That is on 28th. We have a session here, the
yes,
part of phosphorus again, so that we can go ahead in that way also.
yes.
Hope that's so. Let me.
So let me invite some questions.
Yes, yes.
If
And not
any question is there.
not only questions, we can also have a.
Thank you everyone for patient hearing.
Yes, those who really want to participate in discussion and or as well as questions, as well as addendum, those who want to add something more to this also can add. I invite our president, Dr. Seth sir, to begin the session, sir. Yes, sir, please unmute, sir. You are co-host now. Seth sir, you can speak. Okay. You're unable to open. Okay, so I invited Dr. Hariharan sir to begin the session. Yes, please unmute.
Hello. Hello, Harry. Can you hear me, doctor?
Yes, yes, sir. You may
Yes, yes.
continue.
Okay, very beautiful presentation regarding phosphorus. See, phosphorus is the jewel in our material.
Yes, sir. Yes, sir.
It is the jewel.
Definitely.
All the homeopaths are very much fond of this phosphorus and giving a lot of result. See, last time, 2 years back, I got a benign vertigo, positional vertigo. And even I can't go to outside, severe vertigo. And the symptom was that vertigo, morning, aggravation by rising after. And another is turning the head or moving the head, another route. See, another is that balancing sensation. I can't walk because see, imbalance is there. Next is fault tendency. This is the I mean about 4 rubric, and I repetized it, and I got the phosphorus and graphitis. But I took Grophitis, I mean phosphorus 0 bar 3, 0 bar 3, 1 dose thrice daily. 1 dose thrice daily. Only 1 dose, and it is diluted in a half ounce of glass, and I
Yes,
took
yes.
it in one spoonful 3 times a day. Next day, I got relief. Now, yesterday I took 1 dose of phosphorus 200, and complete vertigo disappeared, and balancing this sensation is also disappeared. That is phosphorus. It is my own
Thank-
experience. Recent, my own experience.
Good, sir.
Thank you, Hariran Doctor, for sharing such a case that you yourself felt it. Yes, now, as I said, sir, can you try once again? You are a co-host, but you can't unmute. Sir, you may leave and join. Then we can do one thing. So it's up to Dr. Manoj. Please unmute.
Thank you, Dr. Sanesh and Dr. SUMANA KUMARI PANDA. Nice presentation, and we all know that the medicine of phosphorus. Why we
Okay.
are so much familiar
I
with.
think
Yes, sir.
you are listening my voice, Vaiko?
Yes, yes. Audible, sir, please.
What's the name of that doctor, young doctor?
Dr. Sumana Kumari Pande.
Where from?
From
Odisha.
Odisha, Cuttack.
Okay, fine. You are monitoring of the phosphorus is very fine. This is our king medicine of the bleeding. And the king
Thank
medicine
you,
of
sir.
the beautiful and handsomes. These are the construction of our phosphorus, no? Phosphorus is very beautiful girl and handsome man with all complaints. The personality is very high up. The bleeding case, it can be controlled, any type of bleeding, as per the symptomatology is agreeing. So you are talking of the phosphorus is very nice. I congrats. Come again and again in the platform and give your comments in homeopathy. Okay.
Okay, sir. Thank
Thank
you very
you,
much,
sir.
sir. Thank you very much. And now it's over to Dr. Manoj.
Thank you, Dr. Ganesh. We all know that a few symptoms are added to phosphorus from the match industry. Of the
Yeah.
It's the pathological symptoms. Then again.
Fire.
Yes. Then some symptoms are often from sensations. Sensation as if. That is why we can use in some this necrosis of bone, some other complaints. That means when you give the potentized phosphorus, it will not produce this kind of pathological change in persons, but it will produce symptoms very similar, sensation as if. So that is why phosphorus is advocate such cases. Anyway, nice presentation. There is no doubt about your skill, your potential, and your aptitude. Thank you, Dr. Once again. Thank you.
Now, in day after tomorrow, really, Dr. Manoj, I am having another session. In that session, I will go for all mental generals.
Yes.
With cases.
Fine. Thank you.
Okay, today, anyway, the present phosphorus outlook, if you look at a child who is entering into the clinic, and you can see the patient, doctor, you looks beautiful.
Yes.
He will touch and, beautiful shirt, doctor, your this thing is very good, and where from you bought all these things, and doctor, what did you, what about your disease, doctor? Well, all those questions will come out. You just simply wait and see what the child is doing. Also, she may sit very close, and sometimes she or he may come to and will sit on the lap of the doctor because of so much of affectionate, so much of love, so much of things, activities, and everything. And she sometimes. You may think that it is a very small child, and but it is very lovely. And whatever be the disease, no need of just naming any particular disease, whatever be the disease, the medicine of phosphorus will work in those conditions. The generally itself will lead you to the right side. And then sometimes the patient may say, "Oh, doctor, I can't lie on the right side every time. But whenever I try to lie on the right side, I may find it very difficult to sleep, or very my conditions may aggravate." That's one of the specific nature of phosphorus also. Anyway, thank you for joining the session, and I invite Dr.
No,
Manoj.
Dr. Dhanesh, I want to just say one sentence that all these things, mental symptoms we are discussing, that is, I will discuss in next session, that
Okay,
is soric phosphorus. But what
okay.
is about the syphilitic phosphorus, the symptoms are just the reverse. So,
Yes, exactly.
so that
Pathology,
also I will
phosphorus
discuss day after tomorrow.
pathology should be listened, no? In the pathology stage, very carefully use the phosphorus in the potency.
Yes, sir.
Where you can administer Euroba 3 or something like that. Where you will not get any mass aggravation.
Yes, sir. The day after tomorrow, we will have the second part of the phosphorus by
Yeah, fine.
SUMANA Kumari Panda, doctor. And now we invite Dr. Manoj to say vote of thanks to the sessioners.
Thank you, Dr. Ganesh. Nice presentations. On behalf of IFPH, I'm expressing sincere thanks to Dr. SUMANA Kumari Panda and
Thank
all
you.
those participant session. Thank you.
Namaste.
Tomorrow, we will have a session from Dr. Jaydev Sharma. We'll be talking about a retrospective approach in autoimmune disease, and he's a very follower of Dr. Praful Vijay Khartoum, and of course, that will be a beautiful session tomorrow. Hope all of you will be here with us. You can use the same link for tomorrow's presentation also. There is no change in the link, so we invite. Hope all of you will be there in the same team. Thank you all. Once again, thank you, Dr. SUMANA Kumari Panda. And
Thank you, doctor. Thank you
thank
very
you all.
much.
Good night. So,
Good
over
night.
to Dr. Mariama John to moderate the Malayalas.